Hydrocodone and acetaminophen is one of the combinations that is used to control moderate to severe pain in the people. This combination can be used to control the pain where other analgesics are ineffective. In this combination, the two drugs belongs to the different categories. Hydrocodone is a opioid agonist, whereas acetaminophen is an analgesic and antipyretic. When hydrocodone is used alone, it may have more risk of addiction. That's why it is combined with acetaminophen to control moderate to severe pain in the people. This combination is available as tablets as well as they're also available as oral solution. Here two drugs can be combined at different strengths. So these formulations are available at variable strengths. So today in this video we are going to discuss the key facts about this combination. How is it given? What is the effect on lungs? What happens with the overdose and how it is treated? What are the important precautions, side effects, doses? All such key facts we will discuss in this video. First of all, let us see how it works. Hydrocodone is an opioid agonist which can act on the brain and it reduces the pain signaling. Particularly, it can reduce the pain perception at cerebral cortex. Pain signaling is carried through nociceptive neurons and these neuronal activity can be controlled by hydrocodone. On these neurons, various types of targets are expressed. Among these, one of the important target is the opioid receptors. These are the mu receptors on which hydrocodone can act as agonist. When hydrocodone binds on these receptors, they can open outgoing potassium channels. When these potassium channels are opened, potassium can go outside, resulting in the hyperpolarization. This results in the decreased activation of nociceptive neurons, thereby pain signaling is going to be inhibited. In this way, hydrocodone can reduce the pain signaling as well as pain perception in the cerebral cortex. On the other hand, acetaminophen acts in a different way. It can inhibit the activity of COX enzyme cyclooxygenase. Even though it is non-selectively blocking the COX enzyme, it can show its activity on COX-2 as well as COX-3 enzymes. By blocking these enzyme activity, it can inhibit the prostaglandin synthesis. Particularly, it can inhibit the synthesis of PGE2. By this, it can inhibit the pain stimulation through the prostaglandins. Therefore, it can produce analgesic action. Even this medication can reset thermostat in the body, thereby it can reduce the body temperature. So it acts as analgesic as well as antipyretic. However, acetaminophen is combined with hydrocodone to produce its analgesic action. What are the side effects? The important side effects of this combination are mainly related with the opioid component, that is hydrocodone. This hydrocodone can produce some dizziness leading to lightheadedness in the people. Since it reduces the CNS activity, it can also produce some drowsiness and sedation. It can also reduce the GI motility that may result in the constipation, and hydrocodone can also produce contraction of bladder sphincters leading to urinary retention. Other side effects like anxiety, mood changes, inactivity can also be observed in the people. Even though rare, this combination can produce few of the hypersensitive reactions that may result in pruritus, itching sensation and skin rashes in the people. Use with CNS depressants. Benzodiazepines are well-known drugs which are used as sedatives, hypnotics and anxiolytics. They can produce sedation and when they are combined with hydrocodone, they can produce a significant sedative effect. Therefore, benzodiazepine should be carefully used with hydrocodone and acetaminophen combination. Similarly, other drugs like antipsychotics, tranquilizers, anesthetics, and centrally acting muscle relaxants, all these medications can produce CNS depression. So when they are combined with hydrocodone, they can produce sedation as well as they can increase the respiratory depression that is produced by hydrocodone. That's why these category of drugs should be carefully used with hydrocodone and acetaminophen combination. Effect on liver. Acetaminophen is safe under normal doses, but when it is used at higher doses above 4 grams per day, it can develop acute hepatotoxicity. That's why acetaminophen should be used less than 4 grams per day. Normally, the single dose of this combination contains 325 mg of acetaminophen. However, this combination can be given multiple times and each time multiple tablets can be taken. Therefore, the total dose per day should be less than 4 grams in case of acetaminophen. Similarly, at each time of administration, the net dose of acetaminophen should be less than 1 gram. By taking these precautions, hepatotoxicity can be controlled. Use with alcohol. Alcohol can have dual effect on hydrocodone. Alcohol can directly produce a sedation, which is further increased by use of hydrocodone. So when alcohol is combined, significant sedation can be observed. Another effect of alcohol is on the release of medication. Alcohol can increase the release of hydrocodone from extended release capsules. So this increases the exposure of this medication, which increases the risk of respiratory depression. Therefore, alcohol should be avoided with use of hydrocodone. Enzyme inhibitors. Hydrocodone is metabolized in the liver and it is going to be converted into metabolites by cytochrome P450 system. Among these, CYP3A4 is one of the abundant enzyme, and this enzyme can be influenced by many of the drugs. CYP3A4 inhibitors like clarithromycin, ketoconazole, ritonavir, fluconazole, and so many drugs can influence the metabolism of hydrocodone. These drugs, when they are administered along with hydrocodone, they can inhibit the activity of CYP3A4 enzyme, which inhibits the metabolism of hydrocodone, leading to its toxic levels. This may result in significant sedation, drowsiness, confusion, and respiratory depression in the people. That's why whenever CYP3A4 inhibitors are used, the combination of hydrocodone and acetaminophen should be carefully used, and if it is required, the dose should be adjusted in order to avoid toxic effects of hydrocodone. Effect on adrenal gland. Use of opioids like hydrocodone can affect the adrenal gland and they can produce adrenal insufficiency. This can be observed when this hydrocodone is used greater than 1 month. In such people, few of the symptoms can be observed like development of nausea, weakness, loss of appetite, dizziness, and low blood pressure. Therefore, if you observe any of these symptoms, it may indicate adrenal insufficiency with use of hydrocodone. In such conditions, corticosteroids can be administered in order to restore the condition, and the dose of hydrocodone may be modified to minimize adrenal insufficiency. Effect on blood pressure. The combination of hydrocodone and acetaminophen can reduce the blood pressure. They can produce hypotension, and particularly they can induce orthostatic hypotension. It is a condition of drop in blood pressure due to the change in the posture. It is also called as postural hypotension. Such orthostatic hypotension or postural hypotension can be observed with use of hydrocodone and acetaminophen combination. And this effect is more pronounced in the people with volume depletion because of use of medications like diuretics or due to severe loss of blood. And this orthostatic hypotension can also be pronounced with other drugs like phenothiazines. Phenothiazines are one category of drugs which are used as antipsychotics. When these phenothiazines are combined with hydrocodone and acetaminophen, the orthostatic hypotension is more pronounced because these drugs can block alpha-1 receptors, thereby they can reduce the blood pressure. And even this combination can increase the CNS depression, leading to sedation and dizziness in the people. Next one is the overdose. Hydrocodone is one of the important medication in this combination. When it is given at overdose, it can produce CNS depressant activity, leading to significant sedation and respiratory depression. It can also produce severe confusion, dizziness, blurred vision, and even coma and death in the people. Even the acetaminophen overdose can lead to liver toxicity, but it has a broader limit compared with hydrocodone. So when this hydrocodone is given at an overdose, it can produce significant central depression. It can be treated by using antagonists like naloxone. Naloxone is a opioid antagonist which can block the activity of hydrocodone, thereby it can reduce sedation as well as respiratory depression. Now notice the contraindications of this combination. The combination of hydrocodone and acetaminophen should be avoided in few of the people, since hydrocodone is an opioid which can produce bronchospasm and difficulty breathing. Therefore, in the people with severe asthma, this combination should be avoided. Similarly, hydrocodone can reduce the gastrointestinal motility. Therefore, in people with gastrointestinal obstruction, again this combination should be avoided. Even though rare, this combination may produce hypersensitivity. This may lead to skin rashes and itching in the people. In such conditions, this combination should be avoided. Now let us see the doses of this combination. The combination of hydrocodone and acetaminophen are available as tablets. Both of these components are incorporated into the single tablet. However, they are available in different strengths. In these tablets, hydrocodone strength may be variable from 2.5 mg to 10 mg. Similarly, acetaminophen may be present at two strengths, either 300 mg or 325 mg. And this combination is also available as oral solution for ease of administration. The dose of this combination depends on the patient conditions and severity of the pain. Normally, it can be taken as 1 to 2 tablets to control moderate to severe pain. The dose can be repeated after 4 to 6 hours. However, they should be given under the maximum dose. The maximum dose is different for both of these components. In case of hydrocodone, the maximum dose is 60 mg per day, whereas in case of acetaminophen, the maximum dose is 4 grams per day. Under these limits, this combination can be given to control moderate to severe pain. So that's all about this combination, hydrocodone and acetaminophen. This combination is used to control moderate to severe pain in the people where other analgesics are ineffective. However, this combination contains hydrocodone, which is an opioid agonist, which may have a property of addiction. In order to reduce the addiction, it may be combined with acetaminophen. Still, this combination may show some addiction in the people. This combination can produce some drowsiness, dizziness, sedation in the people. And at a toxic dose, hydrocodone may produce respiratory depression. So it should be carefully given such that the maximum dose is less than 60 mg per day. Acetaminophen at overdose can produce liver toxicity, so it should be given at a dose less than 4 grams per day. So that's all about this combination, hydrocodone and acetaminophen. I hope this video is useful to you. If you really like this video, please subscribe to our channel and hit the like button to support our work. Thanks for watching. See you in the next video.